job. Well, in a few weeks, many persons are going to be heading to Brazil for World Cup 2014. Ahead of the journey, we've invited Dr. Yohann White to share a few tips for staying healthy in the land of Samba. Good morning to you, Doc.
Hi, good morning.
Are many people coming to you now, saying they're heading off to Brazil and asking you what to do?
I've had a few calls, and it's mostly about preparing for the trip and what to expect. And the Ministry of Health has also put out some guidelines for physicians, which was circulated, I think, last week. And we ask patients to consult their physicians or a travel health specialist about 4 weeks before departure. In the event that they have a chronic medical condition that needs to be optimized or put under control before giving, for example, vaccines that they may need, depending on the destination that they're heading to. And that will give you adequate time to give all the vaccines or all the shots that are needed and any special medications that they may need.
Do you need shots to go to Brazil? What shots would you need?
Well, in Brazil, the biggest concern for us is yellow fever, which is in transmission in almost the entire landscape of Brazil. The only exception being the northeastern coast, but the rest of Brazil.
How is it transmitted, for those who don't know?
By mosquitoes.
Right.
By mosquitoes.
So that shot essentially makes you, what's that word?
Immune.
Immune
or
to,
protects you.
okay.
So the yellow fever vaccine is usually administered about 10 days before departure. So it's very important to consult your physician before that, as well as to give your physician or health care worker, nurse, for example, the opportunity to assess you to see if you're the right person for that vaccine, because not everybody is supposed to receive the yellow fever vaccines. There are contraindications. So kids under 9 months old or infants should not receive yellow fever vaccine, and persons who have certain deficiencies in their immune system, so weak immune system. So all those things would have to be optimized before.
Did you know that yet?
I absolutely did.
Right.
So if you don't get that yellow fever shot, you really ought not to be going anywhere.
You can go if you're going only to the matches. In Brazil, the matches are in several places. Some of them are close to the Amazon River, which cuts across Brazil from the northern eastern end and further southwesterly, sorry. So those sites that are close to the Amazon, you definitely need protection. But if you're going to the northeastern coast, for example, you should be okay. What you can do is protect yourself from mosquito bites by using DEET, or an insect repellent. And one common question we normally get from patients is, what percentage DEET should I use? It's supposed to be 100%, 60%, 70%. So we usually recommend about 50%. You don't need to go higher than that, because you have you're more prone to getting hypersensitivity reactions to the DEET, or kind of allergic-like reactions to it if it's too high. So about 50% should be enough to protect you.
There are some people who say this whole vaccination thing is all a ploy to make money for pharmaceutical companies. There really isn't a necessity per se to be vaccinated. What would you say to those persons?
Well, vaccines are an important tool for us as physicians or public health workers to protect the population from certain diseases, and we've been able, for example, to eliminate smallpox because of a vaccine. So a vaccine is really just a sample of a particular germ that you give to the immune system, so you could either kill it or inactivate that germ, present it to the immune system or to your body. A little by little, it gets your body used to it, trains your body to fight it every time it sees or encounters that pathogen or that germ in the future, and that will give you protection from that germ. And it's important in not only protecting you, but protecting others around you who may not have received all their vaccines or all the protection just yet. So it's a very important public health tool.
Is yellow fever the only vaccination recommended for those traveling to Brazil, or are there others?
That's an excellent question, Yendi. In fact, we forget about the other things that we would normally receive as children. For example, measles and tetanus shots. So by the time you're 30 or in your late teens, you really do need a booster for tetanus, for example, so every 10 years. And when you travel, or whether you're traveling within your country or overseas, one of the biggest problems we have is injuries, right? So injuries and motor vehicle accidents, that's actually a bigger problem than infectious diseases, even though I'm an infectious diseases focused person. But traveling is associated with injuries, and that's because of not being familiar with the roads that you're on. You're not sure
Right.
which side of the road you're supposed to be on. You're not familiar with the tracks. Some
So
of them
learn
are
those
very
safety
narrow.
tips before you head
Right.
out. People who are taking this long flight or any long flight, I see you note here to be, well, clots in the veins, one
Right.
concern.
Right. So that's important. So if you're on the longer flights, for example, going to the UK, or if you have several connections before you get to Brazil, or you're going to some other destination. So this is a general useful tip. Avoiding agents that dehydrate you, and one of them is coffee. So you're going on a long flight,
you
you're not sure you
don't.
want to fall asleep, or you're trying to keep awake, so you drink a lot of coffee, but coffee
Dehydrates
causes
the
you to
body.
pass a lot of urine
Right.
and dehydrates you, and that causes, that increases the risk of getting a clot in your veins, especially women of a certain age.
Oh, thank you, Doc, for telling
or
me
if
that.
they're on certain medications.
Also, alcohol dehydrates the body.
Alcohol also does that too.
Okay, how important is it to have access to medical doctors when you're traveling? Should you go and then when you reach, you say, okay, where's the nearest doctor, just so you know?
That's very useful. In fact, I'm a member of a network, the International Society of Travel Medicine, as well as the International Association of Medical Assistants to Travelers. So we're a network of physicians, about 1,657 physicians, the last count, and we keep in touch. So if there's a patient who is traveling who is in need of attention, we have a listing of global travel health clinics.
That you can recommend to the
Right, and we
patient.
can
Cool.
call or send an email to a colleague for that patient to be seen.
We mentioned vaccinations, we mentioned the dehydration
Right.
and the general tips, but let's speak specifically to diabetes and hypertension,
Right.
because there are things that we need to look out for if we're suffering from any of those
Right.
chronic illnesses.
Yes, you definitely need to have your medications, and you definitely need to be optimized before your trip. So you have to have your blood sugar under control, and that means going to your physician, making sure that you're on the right kinds of medications, making sure that your blood sugar is at a certain level, and ensuring that you're not having any infections on board, for example, a cut on the leg that's not healing and so on. So you want to optimize your condition. And in the event that you need a vaccine, for example, you will not respond to the vaccine effectively if your condition is not optimized.
Right.
Because diabetes is
Leaves you
also
vulnerable.
right. It leaves you vulnerable, and it weakens your immune system if it's not under control.
Sorry, Doc, I have to ask. You mentioned making sure you have the right medications.
Right.
Do you write me something for border control to say I'm allowed to carry these medications for this particular illness?
That is very helpful. In fact, the Center for Diseases Control and Prevention on their website, which has tips for travelers, recommends that you visit your physician, get a prescription for the medications that you're supposed to be taking, as well as getting a note from your physician that's signed on the physician's letterhead and stamped for you to take with you. What is also recommended is that you take your medications in your carry-on luggage and not to pack them in the event that
the
it gets lost or misplaced.
All right, Jack, we have to go. Thank you for the information. And we also
Thank
want
you.
to remind folks who are heading off that when you come back, you should really go and get a checkup as well, correct? It's not about
Yes.
but after you come back,
Definitely
you should.
important. So up to a year
Okay.
afterwards, if you mount a fever, up to a year, it could be malaria, it could be some infectious disease. So you have to really keep in check. Yes.
Okay. Thank you very much.
Thank you so much for having
Lecturer in
me.
the departments of both medicine and microbiology at the UWI Medical Doctor, Dr. Yohann White.
All right, stay tuned to find out. Thank
Welcome.
you. Stay tuned to find out the latest steps being made in the fight against extortion. We'll be right back on Smile.